And good morning. I want to welcome everyone. I'm Josh Britton from the Ethics and Public Policy Center. This is our live on the record briefing on the objections to the proposed HHS Title X rule. So what we're going to do today is have a few presentations from folks who are involved in this effort to walk through some of the objections, and they're gonna lay out the issue for you, and then we're going to open it up to questions. During the Q&A time, we're going to limit that to media participants only. We have some other folks, coalition partners and others listening in, but the Q&A portion will be for our media participants only. So when it's time for the Q&A, I will invite you to signal by either typing in the chat box or raising your hand. Sometimes it's a little tricky for folks to find that raise hand button, but if you can indicate one of those two ways, I will call on you when it's time for the Q&A. So it looks like most of our folks are here, so we're going to go ahead and get started. Joining us today as presenters are Roger Severino. Roger is a senior fellow at the Ethics and Public Policy Center, where he directs EPPC's HHS Accountability Project. Before joining EPPC, Roger was the director for the Office of Civil Rights at HHS, and he was the longest serving OCR director of the past 3 decades. And he also founded there the federal government's first division dedicated exclusively to conscience and religious freedom compliance and enforcement. Next, we'll have Valerie Huber. She served in the HHS Office of Global Affairs as the U.S. Special Representative for Global Women's Health. She was a principal on the Title X regulation under the Trump administration, which for the first time in its 50-year history eliminated Planned Parenthood from annually receiving nearly $60 million in taxpayer funds. And then we'll have Denise Harley, who serves as senior counsel with Alliance Defending Freedom, where she's a member of the Center for Life. In her role there, she focuses her litigation efforts on defending the First Amendment freedoms of pro-life healthcare professionals and pregnancy resource centers. So I'm going to turn it over to Roger to begin our presentations, and we'll hear from our panelists and then take some Q&A.
Thank you very much, Josh, and thanks to the members of the media for joining us today. 30 days ago, President Biden's HHS, under the leadership of Secretary Javier Becerra, proposed a rule change that would be a favor to the abortion industry and big abortion. Under Title X, family planning clinics receive tremendous amount of federal funds. However, in 2019, the Trump administration made clear that those funds could not be commingled with abortion activities. There had to be strict physical and financial separation. Title X, the statute itself, says, quote, "In programs where abortion is a method of family planning," end quote, you cannot have the mixture. In programs where abortion is a method of family planning. This is common sense. The American public do not believe abortion should be used as your primary method of birth control. We have federal laws spanning decades where we have prohibited taxpayer funds from being used to fund abortion, the Hyde Amendment being the quintessential example of that. And that is, of course, also integrated into the Title X statute. Unfortunately, President Biden had promised to undo the Hyde Amendment, which would, of course, take an act of Congress. But barring that, I guess he's going for the second best option, to find any way possible to make sure that the federal funds keep flowing to allies in the abortion industry like Planned Parenthood. Planned Parenthood was a participant in Title X programs. When the 2019 rule came through, Planned Parenthood and many of its affiliates decided to voluntarily back out. They chose to keep their abortion prioritized over family planning services. If they had agreed to separate their physical and financial operations, their abortion on one side and Title X family planning services on the other, they would have been perfectly fine and could have continued. But of course, they chose abortion first because Planned Parenthood and abortion clinics are about abortion first, family planning second. The Title X program is about $286 million. There are 71 recipients, and we are part of a large coalition of 20 organizations that are submitting comments today against the rule. These coalition members include members of religious organizations, of legal advocacy groups, think tanks, policy leaders, thought leaders, medical professionals who are on the front lines, who care deeply about where our money goes. Is it going to fund the ending of life through abortion, or will it fund what Congress required, which was family planning? An additional major problem with this proposed regulation is that it would coerce participants into referring for abortion. The Title X program does not require referrals for abortion. In fact, we have federal law that prohibits it. We have multiple conscience protection laws, including the Weldon Amendment, the Church Amendment, and the Religious Freedom Restoration Act that prohibit forced referrals for abortion. Again, this follows with our best traditions of tolerance in this country, where whatever people think about the wisdom or legality of abortion, you don't force people to perform it, pay for it, refer for it, or assist in it. That is federal law, which is being shunted aside by this proposed rulemaking. The Biden administration proposed a 30-day deadline for public comments, which is unusual to be so short for something of so significance. I believe because they're trying to rush out this rule to get ahead of the Supreme Court, which is considering this issue right now. In Russ versus Sullivan, back in the 80s, the Supreme Court already ruled that the rules from the 1980s with respect to what governs the Title X program, with respect to referrals and discussions of abortion, gives the federal government tremendous leeway for what was contained in the 2019 rule. Abortion should not be treated as a method of family planning, and nobody should be forced to refer it as such. It is as simple as that. We believe the Supreme Court would affirm that principle, and this is an attempt by the Biden administration and Javier Becerra to get around a bad Supreme Court ruling and to pay back their allies in the abortion industry. This is not about the service provision. It is about payback for those who believe that abortion is more important than family planning services. With that, I'm going to turn it over to Valerie Huber to speak about the programmatic aspects of the proposed rule. Valerie.
Thank you, Roger. Well, good morning, everyone. I served as the acting Deputy Assistant Secretary for the Office of Population Affairs, which is the office with jurisdiction over the Title X program. I was serving in that capacity during the time that the Trump rule was making its way through the official process. And I can say that we were laser focused on ensuring that the requirements of the statute and then the related congressional mandates guided the policies that we included in our regulation and then were used to implement the program in the field. As Roger pointed to just a couple of minutes ago, this program was established in 1970. It is the only federal program dedicated solely to the provision of family planning. And I want to just quote one portion from the statute. It provides funding, quote, to assist in the establishment and operation of voluntary family planning projects, which shall offer a broad range of acceptable and effective family planning methods and services, including natural family planning methods, infertility services, and services for adolescents. In other words, the Title X program is expressly devoted to preconception services, either helping clients achieve pregnancy or helping them to delay pregnancy. And from the start, Congress was very clear that none of these funds should be used to support abortion. But in addition to that, Congress also mandated a few other things. If pregnancy options counseling took place, it is not to steer a patient toward one choice or another, and it's not required. Family participation is to be encouraged, particularly in the services involving adolescents. Minors should receive counsel on how to avoid sexual coercion, and Title X providers have to comply with the state sexual abuse reporting laws. Now, our Title X regulation for the first time ever embedded all of these key legal as well as legislative provisions into the policy surrounding the implementation of the program. What that means is that not only did Congress mandate it, but we made sure that the programs also implemented each of those requirements in a meaningful way. The Biden-Becerra proposed rule removed the ones that evidently they didn't like. But here's the thing. When Congress mandates something and when the law requires a program be implemented in a certain way, HHS has neither the authority nor the freedom to pick and choose what to ignore. I'm particularly concerned with the proposed rule because it, first of all, blurs the line between Title X services and abortion services. It ignores the inclusion of key congressional mandates. As Roger said, withdraws sufficient conscience protections. It also removes grant review criteria that we included to not only ensure statutory compliance, but also to improve coverage, competitiveness, and also the quality of grantees. And it also foreshadows what I believe is a return to hostile restrictions on the grantee's ability to select subrecipients of their own choosing. I wish that we had time to go through each of those. We won't have time to examine each of those points, but I want to take just a couple of minutes to compare the Title X regulation that we finalized under the Trump administration with the proposed rule published by the Biden administration. We're going to look at how they square with legislative and statutory mandates and how two examples that I'm going to be bringing forward are really emblematic of both the tone and the tenor, well, and actually the content throughout the proposed rule. So first, number one, abortion referral. The Title X law states, again, as Roger stated, but I want to say it again, none of the funds appropriated under this title shall be used in programs where abortion is a method of family planning. The word where in that prohibition compelled us to draw a bright line between where abortion activities took place and where Title X activities should take place. Naturally, that would require physical separation between the two, but it also stands to reason that it also includes any activities that are considered, and let me quote now from the 2019 rule, encourage, promote, support, or advocate for abortion as a method of family planning. Therefore, in our regulation, we prohibited not only the actual provision of abortion, but also abortion referrals as a method of family planning. Now, this differs from the 2021 proposed rule, which requires abortion referrals as a method of family planning. I want to quote from page 19,818 of the Federal Register, where HHS will, quote, allow Title X providers to refer their patients for all family planning related services desired by the client, including abortion services. To me, HHS is acknowledging that their referring for abortion is for the purpose of family planning. In other words, they're permitting some Title X funds to be used in programs where abortion is a method of family planning. I believe in direct violation of the statute. The second point that I want to make is in regard to the congressional requirements. As I mentioned a couple of minutes ago, we made it a point to include every single congressional mandate within the 2019 rule to ensure that grantees not only understood these mandates as both a requirement and a priority, but that they were also meaningfully implemented in the program. Anyone who's worked with federal grants know it's one thing for a grantee to sign a blanket agreement saying that they'll comply with certain congressional mandates, but it's another one altogether to require that they have a policy and an implementation plan in place, and that staff are required to be trained so that they know how to incorporate these. We made those requirements for mandatory reporting for sexual abuse and assault, for encouraging parent-child communication regarding family planning decisions of a minor, and also for counseling minors how to avoid sexual coercion. all things Congress requires. Becerra's HHS retained a portion of the requirements for mandatory reporting, but they removed measures that would help providers identify if adults are sexually abusing minors who come to our clinics. In addition to that, they completely removed our operationalization of other congressional mandates. So they removed including practical ways for minors to discuss family planning with their parents or other family members. They removed encouraging couples to communicate about and to share in family planning decisions together. And they removed the requirement that minors receive counsel on how to avoid sexual coercion. These were all present in the 2019 rule. They were all required by Congress, and they were all removed within the proposed rule. There are a lot of other problematic themes in the proposed rule, but I think these two are indicative of a theme that runs through the rule. Simply put, as currently written, it's more focused on ideology than on the congressional intent and the statutory provisions, or for that matter, even on implementing authorized family planning services to low-income Americans to achieve or prevent pregnancy. And that's a problem. Well, to share a little bit more, I am pleased to now give the baton to Denise Harley from ADF to share additional comments.
Thank you, Valerie. Good morning, everyone. I just want to touch briefly on the effect of the proposed rule on women, on the taxpayers, and on healthcare professionals' conscience rights. Americans should be free to live according to their deeply held religious beliefs. And no American should be forced to pay for or participate in abortions. The Title X Family Planning Program, as you've heard, was established by Congress decades ago and makes clear that abortion is not an acceptable form of family planning. The current Title X rules ensure the taxpayer dollars don't fund programs promoting abortion as a method of birth control. But the revised Title X rule would compromise taxpayers and healthcare professionals' freedom of conscience by requiring Title X participants to offer or refer patients for abortion and contraceptives. It would also limit options for women by forcing providers who offer natural family planning services out of the program entirely. Freedom of conscience is a fundamental right for all American citizens. 48 states have laws protecting healthcare professionals' conscience rights right now. But the new Title X rule overrides these state laws protecting conscience rights and would force religious centers and healthcare providers who participate in Title X to engage in abortion referrals against their deeply held religious beliefs. The revised rule targets everyone who believes abortion is not birth control, and it imposes a one-size-fits-all method of family planning on the public. No government should require medical professionals to violate their conscience in order to participate in a government healthcare program. There's a growing consensus in the states that family planning programs can secure access to quality patient care and also make sure that taxpayer dollars don't fund abortion. There are 9 states which have laws ensuring Title X money is not used to fund abortion, and 17 states have similar restrictions for state family planning funds. Family planning providers have been flourishing under the 2019 Title X rules, offering women and families access to a broad range of services, including natural family planning and expanding care in many parts of the country. Contrary to HHS's claims, the new Title X rule limits options by imposing the government's preferred method of family planning on all and mandating that participants who offer natural family planning not only refer patients for contraceptives and abortion, but also counsel them on abortion as an acceptable option. The revised rule would force religious family planning providers out of the program because they can't in good conscience abide by the government mandates. This would restrict options for women, and it's also illegal. The Title X statute requires natural family planning providers to be included in the program. Forcing those providers out is a violation of Title X itself. Women should also have the freedom to choose a family planning method aligned with their beliefs. And taxpayers should not have our taxpayer dollars used to promote abortion. The Department of Health and Human Services proposed revision targets the basic conscience rights of American citizens by funneling business to Planned Parenthood and big abortion. This reflects government hostility towards people of faith, which has no place in our society. Title X should not be used to punish people of faith. And government programs certainly shouldn't be used as an advertisement and a revenue stream for the abortion industry. Thanks so much. And I think Roger and Valerie are now going to field questions.
And before we move on to the Q&A, the Russ versus Sullivan decision that I mentioned was 1991. The Reagan era Title X regulation was 1988. And today there was a Supreme Court dismissal of a petition for intervention in the Title X case that I mentioned. I took a quick scan of it. It doesn't dismiss the case. HHS has said to the Supreme Court it intends to treat the 2019 rule as governing until this proposed rule is finalized. So again, it just underscores the fact that they want to rush this through to deprive the ability of the Supreme Court to actually rule on the 2019 rule. Okay, so Josh, please take over for the questions.
All right, thank you very much to Roger, Valerie, and Denise for that helpful presentation of what's at stake in this issue today. So as Roger mentioned, we're going to have time for Q&A from the journalists who are attending today. If you're a coalition partner or another attendee, we ask that you refrain from asking questions as we want to make sure that we're able to take every question that that our media attendees have today. So if you'd like to ask a question, please indicate that to me by using the raise hand function or by sending a chat just with your name and affiliation, and I'll call on anyone who has questions for Roger or Valerie. So I'll give you a second to indicate that. We'll go from there. It's quiet from our questioners. We can give folks a few more minutes. Although it's possible that you guys covered everything there was to say.
For the benefit of everybody on the call, we will be posting all of the public comments from the coalition partners on the EPPC website. If you received the press release, we linked many of the organizations. It's over 20 organizations and counting. Some of those organizations already submitted comments, but we expect all of them will be submitting comments by the end of the day today, because this is the due date, and we will be linking all of those comments so you could see them for yourselves. And another point of clarification, the speakers today, we were speaking on our individual behalves. We weren't speaking on behalf of any other member of the coalition or any other person who had submitted comments in opposition to the rule.
I am seeing a question here from Evelyn Gardet. Evelyn, if you'd like to ask your question to the panelists, we can get you a response. I think I've unmuted you there. You may need to unmute yourself as well. I'm not sure if we're able to hear Evelyn, but she did type her question in and it said, would this include natural family planning options? So Roger or Valerie, if one of you would be able to speak to that question for Evelyn.
I'm happy to respond, but I'm not quite sure what this entails. If she's referring to the proposed rule, or if she's proposing, wondering whether that's included in the statute, which it is.
So I guess what the question might be, what happens under this rule to recipients or participants who use natural family planning as an approach?
Okay, Yeah, I can respond to that. So natural family planning or fertility awareness is a required part of Title X. It has long been a part. What we tried to accomplish in the 2019 regulation was to ensure that it actually had a meaningful part, and that any grantees would offer that in addition to and as a part of the broad range of family planning methods. That is still a requirement of the statute. So it's beholden upon the Biden administration to figure out how they are going to substantiate and implement that part of the statute. Oftentimes, grantees would provide that or make it available, but often without actual training in order to do so. So we made training regarding the broad range of family planning methods a requirement, including natural family planning or fertility awareness. We would hope that the Biden administration would do the same.
And I think the referral requirement for abortion would have the effect of driving out natural family planning recipients. I think there's probably a very strong correlation there, which underscores why, if you want to serve as many women as possible, as many people as possible with the broadest, most comprehensive range of services as required by statute, they should not impose a mandatory abortion referral requirement, because that's just going to limit people's options and drive them out.
Well, you bring up a really good point, Roger, because the proposed rule also makes the requirement that any subrecipient must refer to other family planning methods that they do not provide. And typically that's the responsibility of the grantee, but not a subrecipient that may be providing a single service. So it could make it very difficult in that regard.
I've also just gotten a question by email from Matt Hadrow of CNA, who may be joining us by phone and is not able to use the raise hand function. So I'll read the question he sent to my email, and Roger or Valerie, perhaps you can speak to it. He asks, does anyone have any comment on the Supreme Court's order this morning on a trio of challenges to the Protect Life rule? The court is reportedly dismissing challenges to the rule due to the administration's work to rescind it. So if I think, Roger, you may have mentioned.
Yeah, that's what I was referring to. The order itself is about an intervention. So it's technically, can third parties get involved in the suit? The importance of that is, if the third parties get involved, then somebody will actually vigorously defend the rule. We don't expect that, given the Biden administration has just proposed to undo the rule, that they're really going to put a very good effort to defend it before the Supreme Court. However, that was technically about intervention. The case is still alive. It's still before the Supreme Court. And this rule, I see it as an attempt to deprive the Supreme Court of the ability to rule on the merits, because I believe they will uphold the 2019 rule.
Thank you. And again, if there are other questions, please indicate by either sending a chat message or using the raise hand function. Let's see if anyone else has a question for the panelists. Okay, I'm getting a question here from Dorothy Mills-Gregg of Inside Health Policy. Dorothy, I'll unmute you so you can ask that question directly to the panelists.
Hi, thank you for taking my question. So how does the SCOTUS ruling this morning, how is that going to affect your next steps in terms of the rulemaking process? You're talking a lot about the rule, so I'm curious, what is the interplay there and what are your next steps then?
The decision does not impact the rulemaking process. HHS proposed a rule. They gave a unreasonably short 30-day window to respond. That decision doesn't, the Supreme Court decision doesn't impact that process. Coalition members have submitted their comments in opposition to the rule. We recommend that they preserve the 2019 rule. to the fullest extent possible for all the reasons we just discussed. And now it's up to Biden and Becerra to see what they're going to do. They don't need to do anything, but they told the court that they intend to treat the 2019 rule as still in effect until any new rule is finalized. Of course, question whether or not they're going to really enforce the rule given what they have signaled through their proposed rulemaking. That's a very big danger, that they're going to pay lip service to the actual statutory requirements, where you cannot actually have a program where abortion is a method of family planning as part of Title X. That's what it ultimately comes down to. We're afraid that regardless of the rulemaking, HHS has already signaled to the world their intent that they want to get the abortion industry back into the stream of federal funds. And that's what this is ultimately all about.
I'll just add a PS, and that is the proposed rule currently has a little over 90,000 comments. And while there is not a specific interplay between what happened with SCOTUS and this, it is an opportunity, since the rulemaking comment period is still open, for Americans to weigh in.
Okay, any further questions? Not seeing any. Roger, Valerie, I'll turn it back over to you if you have any other final remarks or anything you'd like to add.
Yeah, this is yet another front that the Biden administration is opening up in the culture wars. We saw this in the questioning of Becerra at his confirmation hearings. He is extreme on abortion, and this is further evidence of that. And with the response of this broad, diverse coalition, you're seeing the public pushback. There's a consensus on abortion with respect to respecting people's consciences that is being violated. And again, the Biden administration is upending these norms, further inflaming the culture wars, but this is part of a long sustained reaction to this assault on life.
I agree with you, Roger, but to add on to that, having worked very closely with the Title X program in the Office of Population Affairs, there are a lot of, especially women, low-income women, who depend upon the services of Title X as their primary source for healthcare. And to have this program become the target of an ideological battle over abortion is unforgivable. And this needs to be implemented in a way that is compliant with the statute and provides the services that are intended, rather than for it to become a bait and switch or an end run for the abortion industry.
Well, thank you all very much. And seeing no further questions, I think that will conclude our Q&A and press conference today. We will, as Roger mentioned, continue updating the list on the EPPC website of public comments submitted by coalition partners. And I encourage you to take a look at that and follow that page to stay up to date with what's happening. Thank you all very much.